Hi everyone, thank you for joining us for another episode of UNESCO Talks. I'm your host, Gabby Menezes. Today we're speaking to Kyriaki Michailidou, who is an associate professor at the Cyprus Institute of Genetics and Neurology. Her work focuses on breast cancer risk and will influence how we screen and prevent the disease for millions of people. Kyriaki, welcome. Thank you so much for joining us. So, maybe you could just start with explaining what are the factors that contribute to breast cancer risk?
Hi Gabby, thank you for the invitation. So my work at the Biostatistics Unit has to do with the identification of genetic risk factors and how we can use those genetic risk factors into a score, a screening tool that we can identify individuals that are at higher risk, and then we can use that information to screen them earlier or at more frequent times. So then we can identify breast cancers earlier. Breast cancer is a multifactorial disease, so it's not just one factor that affects its development, but our focus is mainly on the genetic factors. And there's also two components in that genetic factor. So one component is the inherited breast cancer, which affects individuals that have a stronger family history or more members in their family that are affected with breast cancer. And then there's the general population with the risk factors that are common in the population.
So when you're talking about inherited risks, when women look at their family histories, what red flags should they be concerned about?
So there's different guidelines as to what is considered familial breast cancer, but usually is if there are multiple affected first-degree relatives in the family, like mother and grandmother, and depending on the age also of the affected relatives. But also other factors such as personal history of the individual that might be an indication of potential familial cancer.
And your work really looks at the genetic risks. So you, I think, were working on new risk factors that people should be aware about when they look at genetic data. Can you talk more about that?
Yeah, so basically what the work we do at the Biostatistics Unit and also part of large collaborations such as the Breast Cancer Association Consortium, we try to use data from a lot of individuals from all over the world. So we have data from different studies from different countries, and we try to see what genetic factors are more common in women that have breast cancer compared to the general population. And by identifying these factors, we can then use them like a score, and that score gives us if we're at increased risk or decreased risk of developing breast cancer, and then that can in the future guide our screening strategies.
So is this really going to change how women are screened? Will there be a score basis after their DNA is analysed?
So basically that's the direction that this work is going, and there's some countries that have some trials trying to implement that and see the results of the specific studies. And basically, as I mentioned also previously, breast cancer is not a single factor that causes breast cancer. So there's different factors that come put together, and then there's different risk prediction models that you put all the information in, and then it can give you this score.
When we're talking about many different factors, what other factors should women be aware about?
So there's some factors that women can change with their behavior, but there are also factors that you cannot really change, like the genetics, but also age of menopause, the age of the first live birth, and these are characteristics that an individual cannot change, and also age. So when we age, our risk for developing cancer increases. But there's also some other factors that, like BMI and obesity, and that contribute also to this multifactorial risk.
And how did you get into studying breast cancer risk?
So I'm a mathematician, so I started my first degree mathematics in Greece, and then I did a master's in statistics, and then I had the opportunity to work in this big project at the University of Cambridge, which it was on statistics of breast cancer, so this is how everything started. And then after working on the project and the team, it is one of the best teams in the world. So it was fascinating and exciting, and I thought this is what I want to do. So after that, I did my PhD at cancer genetic epidemiology in Cambridge, and then everything else is history.
So here at UNESCO, we're really trying to encourage women to become interested in science, technology, engineering and mathematics, the STEM fields, where there's a real lack of women pursuing careers. What advice would you give to young women or young scientists who are really interested in getting into STEM?
I think the most important thing is like to follow your passion. So it's really interesting to see how young girls and also boys, they start from being really interested in mathematics and computers and so forth, and then they try to, because of family reasons, they try to settle in something that is more mainstream as a profession. So I think it's to follow the passion and find people that lift them up. So you need to have the support, and I think the society is changing, so the support is better than before, but I think we are still getting there. So I think if you have the support and trying to follow your passion, be curious, I think that's the most important thing, and that will lead you to make great things in the future.
Kyriaki, you have been recognised for your cutting-edge work in genetics, and you have received the UNESCO-Al Fozan Prize for STEM scientists. What does this prize mean to you?
I'm really privileged, and I'm really fortunate to receive the award especially from UNESCO and the Al Fozan Foundation. I think it's really important to recognize people, and it's even a bigger recognition for me coming from a small country where our resources usually are much smaller compared to other bigger countries, and it's a way of showing that we can actually do great work from smaller places as well.
And I hope it really encourages more women to be inspired by your own path into science. But thank you so much for joining us.
Thank you.
And thank you, as always, for watching us. Please leave any comments and questions in the chat below, and we will get back to you. And stay tuned for another episode of UNESCO Talks.